What I'm going to do is I'm going to go ahead. I know some of you have some chairs and some of you do not. And I know some people are watching at home. We'll just go ahead and try to accommodate for everybody in here and people at home. And I'm going to recruit some of the people that they've been taking my classes. They're standing in the back and in here. And they told me not to recruit them while we're doing the move, but we're going to go ahead and I'm going to recruit them while we're doing the moves. I'm just going to go ahead and give some general information what Tai Chi is about and why we started the classes. So if you've ever done Tai Chi before or you have not done Tai Chi before, I'm just going to go ahead and give general information about Tai Chi. So falls is a very big problem for LMH, for the United States and internationally, obviously. Falls are a major public health problem for all of us. Among adults over age 65, falling is the leading cause of the emergency room visits. And falls are the most common reason for the accidental death among the older adults. Fear of falling is very common in older adults. When we have the fear of falling, obviously we don't want to walk, we don't want to move around, and we have a decline in the function. About 30% of the falls cause moderate to severe injuries. And about 90% of our fractures are caused by the falls. Fractures are more common in elderly women than men. There is various reasons for that. One of them is the osteoporosis, and the other reason is women are more multitasker than men. So when we are multitasking, we're at higher risk of falling. And falls among adults age 60 and older are very costly. Each year, about 50 billion is spent on medical costs related to non-fatal falls. And each year, about 754 million is spent in the healthcare with the fatal causes of falls. In 2018, there were 52 million reported falls, and in 2030, we're going to have about 73 million falls. And these are only reported falls. And we all know so many times we have fallen and we have not reported to our healthcare professionals. Tai Chi program is proven by CDC, and it's proven by so many research that it's been done, that the strength of the postural muscles that we have in our legs and our mobility and flexibility, it improves the balance. The muscle strength and balance are important limiting factor in the maintenance of a functionally independent lifestyle for older adults. As we age, there are changes that it happens in our body. As we age, the changes in our vision, in our hearing, our muscle strength, our flexibility, walking coordination, proprioception, all of those changes, it causes more risk of falls and losing our balance. And certain health conditions, as diabetes, the heart disease, circulation problems, or some of the medication or the interaction of the medication can cause reduced balance, and it can put us at a higher risk of falls. What can we do about the falls? What can we do for fall prevention? Exercise regularly, review your medication. Sometimes the interaction of medication can reduce our balance and cause falls. Check your vision, make your home safe by adding grab bars, railings, and do weight-bearing exercises, especially if we have any signs of osteoporosis or we are diagnosed with osteoporosis. So weight-bearing exercises are going to be more beneficial than non-weight-bearing. Weight-bearing exercises means if you have the option of walking versus bicycling, you want to do the walking. It doesn't mean that bicycling is not a good exercise, but that's the difference between the weight-bearing exercise. If you have the option of walking versus doing the exercises in the pool, weight-bearing is going to be walking versus doing the pool exercises. Make sure you get adequate calcium and vitamin D. Make sure shoe wear is really, really important. Really nice fitting shoe, not flip-flops when you go for a walk or exercise. Take your time while you're doing an activity and manage your chronic diseases. Limit the amount of alcohol. Do not take any chances. Take your time, and then if you need to use a step stool to do something or to get to a higher shelf, go ahead and do that. And if you need help, please ask for help. Has anybody, except the ones that they've taken my class, has anybody done Tai Chi before? Okay. So I'm going to go ahead and talk what is Tai Chi. Tai Chi, probably you've heard what Tai Chi is, but Tai Chi is basically a non-competitive, self-paced series of posture and movement, and it's really slow, and one movement leads to another. And in Tai Chi, we really focus on the quality of movement and the speed of the movement, because that's what makes our balance improve. That we're moving very slow and we're spending time on one leg, and we're taking time on one leg to balance on one leg and move to the other move. And there are so many different kinds of Tai Chi. The Tai Chi that I teach, I am certified through Arthritis Foundation. So I get my certification every 2 years, sponsored by LMH through Arthritis Foundation. So it doesn't mean you have to have arthritis to be doing this kind of Tai Chi. All it means, it's easier on the joint. So it's just easy movement versus doing those like really fast and kicking and all that. The classes that I teach, it's just easy on the joints. And Tai Chi, it's considered meditation in motion. So it does have a meditating factor in it. The history of Tai Chi, as you know, it's been originated in China. It is a form of a martial art. It started in 17th century. And Tai Chi can be practiced regardless of your age, regardless of your physical activity. I do have chairs in my classes. We do start with, if the individuals need to use the chair, we do have chairs available, but majority of the moves that I teach are in standing, so it can improve our balance. And the intensity of the Tai Chi varies depending on the style, but again, I do not use any kind of resistance band or any kind of weights. So we just do the standing exercises to improve our balance. And the classes, the Tai Chi focuses on more on the techniques than strength. So that's how we can improve our balance. Tai Chi is really low impact, and it is suitable for any age. So you can be at any age and be doing Tai Chi. And in order to get the best benefit out of Tai Chi, it really needs to be practiced regularly, or any kind of balance exercises, it needs to be practiced regularly. And with Tai Chi or any balance improvement, you have to be doing it at least for a couple of months in order to see the difference. It's not with the, like the weight exercise, when you do like the bicep curls, you take the weight and then do the bicep curls. And after about like 2 months, you see some muscle tone. Balance is a lot more complicated system in our body that involves in so many different systems. So it does take a little bit longer to improve. There are so many benefits in Tai Chi, but I'm just going to name some important ones. It obviously improves our balance, decreases the risk of falls, improves our walking stability, it improves our functional mobility, it improves our proprioception, which helps us to know where our joints joints are when we're walking. So it improves the stability of our function. It decreases the pain, arthritic pain. It decreases blood pressure. It decreases stiffness. It improves our fatigue. It improves flexibility. It improves our endurance with functional mobility and obviously fall reduction. How does Tai Chi improve with all of this? It increases our strength, even though we're not using weight, but with those slow movement and the weight-bearing exercises and then standing exercises and focusing on the technique, it improves our strength, which helps with our balance. It improves the control of our center of the gravity. I really focus on posture, how we move. So it really helps with our balance. And it improves the knowledge of the limits of stability. So when we're taking a step, when we're taking too big of a step, that there's a possibility that we lose our balance. So we really focus on that technique. So that helps with our balance. It really helps with the core stability, which helps with our balance. And also it improves our coordination and proprioception. So that's how Tai Chi helps with our balance. Any question about Tai Chi or anything that we went over so far? As I said, falls are a major problem internationally. So one of our missions in the hospital to reduce the falls, that was one of the reasons that we started the classes in 2013. And then we have had great results with participants with their functional improvement. Yes. I'm sorry. The cost of the class is for 20 sessions. It is $85, which comes down. Each session is about $4.25. Okay.
Scared him away.
So the way that I teach the classes, I usually start with the warm-up session, and I teach a form on a Tuesday. I teach on Tuesdays and Thursday. I teach a form on a Tuesday, and on Thursday we review the form, and then we do some balance exercises. So if there aren't any questions, we're going to go ahead and do some of the warm-up session and some of the balance exercises. Okay, so if you need to hold on, am I still standing here? That's my spot. Got it. So when you sign up for the class, this is the t-shirt that it comes with the class price. And the participants who are here with the t-shirt, they have taken my class. And there are some like Margie, who does not have the t-shirt, but she knows all the warm-ups. So you can follow, and I have John back there with the mask on, so you can follow all of them. They're trying to hide, but they know all the moves. All right. So if you need to hold on a chair, please do so. Just feel safe. We're going to go ahead and do some of the warm-ups. We'll start with the greeting. So with our greeting, the right hand makes a fist, just comfortable. With Tai Chi, nothing is overstretched, nothing is like tight. Everything is gentle and loose. The right hand makes a fist. This is strength. The left hand, 4 fingers are touching. That's friendship. The thumb makes a triangle. That's humility. Left hand on top of the right hand. That's considered mutual respect. So that's how we start with the greeting. We start with the class with this, and we end with this. The first warm up, you're gonna open and close your hands, just walk around, smile to the neighbor, pretend you're happy to be here. Okay. So the next exercise that we're gonna do, and in my class, I have a big mirror, so I'm facing the mirror so you can go ahead and see the move. But I'm gonna go ahead and do it facing you, and we're gonna go ahead and do it facing the back, I guess. So we're gonna go ahead and start with our neck, then shoulder, our back, our hip and knee, and our ankle. So you're gonna stand with comfortable base of support, meaning you're balanced, so it's not too wide, it's not too close. The joints are soft, so nothing is overstretched. The joints are soft, the elbows are soft, and you're just gonna stand like that. We're gonna go ahead and start with the neck stretches. I'm gonna show you facing this way first. You can just watch me. You're gonna bring the hands up. You're gonna turn the hands facing you, gently push, turn the hands, gently push out. When you go down, you bring your head down. So we're gonna go ahead and do 3 of those. Comfortable base of support, bring the hands up. Turn the hands facing you, gently push. Turn the hands, gently push out. When you go down, gently bend your head down. And again, bring the hands up. Turn the hands facing you, gently push. Turn the hand, gently push out. When you go down, gently bend your head down. One more time. The next neck stretch, you're gonna bring the hands up. You're gonna bring the left hand facing you. Right hand, you're gonna hold on by your hip, like you're putting it on the table. You're gonna turn the left hand and you're gonna turn your head looking at your left hand. Bring the hands in the middle, twist the hands facing each other. Right hand is facing you. You're gonna turn to the right. It's only the neck that it's moving, not the entire body. Bring it in the middle, switch hands, left hand facing you, right hand on the table to the left. Come back to the middle, switch hands, right hand facing you to the right. Come back to the middle. We'll do one more on each side. Switch hands to the left. Come back to the middle. Switch hands to the right. Come to the middle, bring the hands down and finish the move. Now we'll do the shoulder stretches. You're gonna do 3 circles going back. 3 circles coming forward. Now the other shoulder stretch, your shoulders are gonna be diagonal, facing up. You're gonna grab all that energy and you're gonna push it down, gently bend your knees. We're gonna breathe in, push it down, breathe out. One more time. Nice job. Now we'll go ahead and do the trunk stretches, left hand on the top, right hand at the bottom. Let me show you in here. Right hand is going to push the sky, left hand on the table. Then left hand is going to be at the bottom. Then left hand is going to push the sky. Then right hand at the bottom. Right hand pushes the sky. Nice job. Left hand at the bottom. Hold on to the ball. Left hand pushes the sky. Right hand at the bottom. Right hand pushes the sky. Left hand at the bottom, one more on each side. Left hand pushes the sky. Right hand at the bottom. Right hand pushes the sky, and bring the hands down and finish the move. The next one, I talk a lot about, in Tai Chi, I talk a lot about the acupuncture point, about the posture, about the breathing and all that. So we go over all of that. You're gonna hold on to the ball, hands facing each other, left hand on the top. You're gonna go to the left. We're still working on our spine. You're gonna twist the ball. Right hand on the top. To the right. Make sure you have good posture, that you're not coming forward with the ball. Twist the ball, left hand on the top. To the left. Twist the ball, right hand on the top. To the right. Good posture. Left hand on the top, to the left. Right hand on the top, to the right. That's the last one. Left hand on the top, bring the hands to the middle and finish the move. Now we're going to stretch our hip muscles. We're going to think about there's a wall on the right side. We're going to push the wall and we're going to stretch the left hip. And back to the middle. We're going to push the wall on the left, stretch the right hip. Let me go ahead and show you. Yeah, it gets confusing, right? Push the wall on the right, stretch the left. Right. Left. Right. One more on each side. Left. Right. Now the next hip stretch that we're going to do is we're going to bring our hands up. Bring it down all the way back and bring the left hip forward by touching the heel. Now bring the hands up, bring the toes back. Heel forward, toes back. And you want to do very slow and just make sure you're being safe. Back and bring it to the middle. Now we're going to bring the hands back, bring the right heel forward. Toes back, heel forward. Toes back, heel forward. One more time. Toes back and finish the move. Now we're going to go ahead and do the knee stretches. You're going to make a fist with both hands facing up. We're going to turn the fist and punch and back. We're going to turn the fist and punch. Now we're going to do the opposite arm, opposite leg. Remember, everything is soft in Tai Chi, so we're not going to be punching like this. Just gentle, and the elbows stay soft. Elbows stay soft. So if we have 24 hours in a day, this is 145 minutes that I asked to move slow, really slow. Then what we're going to do is we're going to punch and we're going to toe tap with the left and then back. The side that you're tapping, you're not going to put any weight on it. So we are stretching our knee. So it's right hand, left toe tap, back. Right, left, opposite arm, opposite leg. Right. One more on each side. left, right. Now we're gonna touch our heel without putting any weight. Tap the left heel and punch with the right. Opposite arm, opposite leg. Right. Slow, gentle movement. Left, right. One more on each side. Left, right. Now, if you feel comfortable and if you feel steady, the next one, we're just gonna do the gentle kick and punch and back. Gentle kick and punch. Opposite arm, opposite leg. Let's start with the left leg, gentle kick and back. If that's hard to do, just continue either with the heel tap or the toe tap. Left, right. One more time on each side, left, right. The last one for the knee, you're gonna put the left foot forward. We're gonna shift our weight and we're gonna punch. The way that we're gonna shift with the entire body. So this is gonna help us be steady, and also it's gonna help us reduce the risk of injuring our back. So left foot forward, punch and shift with the entire body, and feet are on the floor while you're shifting. Right. Opposite arm, opposite leg. Shift. Feet on the floor, and make sure you're shifting with the entire body. Don't come forward with the back. Right. Keep everything soft. Gentle punch. One more on each side. Opposite arm, opposite leg. Nice job. Now, the last part, we're going to put the hands on top of each other, 2 inches below belly button, where our center of energy is. On the right, we're going to touch our heel, toe, heel, toe, heel, toe. One more time. Now the left. Touch the heel, toe, heel, toe. One more time. Now, the last ankle stretch, we're going to touch the outside of the right foot, then in, out, in. One more time, out, in. Now the left. Out, in, out, in. One more time. Nice job. So those are all the warm-up exercises. So every time we do the warm-up exercises, now I'm going to go ahead and show you in the beginner's class what are all the moves that we're going to learn. Who wants to join? Jane, Michelle, anybody? All right. It's okay. I'm not going to put you in the spot. I'm going to go ahead and show you the moves that we learn in the beginner's class. I'm going to go ahead and do it facing you. I didn't say that. Kathleen said that. All right. I think she's serious that she wants everybody here. No? It's okay. All right. So let's be, I need to be here, right? Okay. Okay. How about if we face them? Okay. So because I want them to see my moves. But I want to be facing them. Are you guys going to be okay if I face them? Okay, well, just try. So I'll be facing them so they can see the moves. Okay. You don't have to do it. If you feel comfortable doing it, that's fine. But these are all the moves that we're going to be learning in 10 weeks. So I just want you to be able to see how slow we're going with all of the moves. Ready? Let's start. They all know the move. This is confusing to them because I'm going the opposite direction that they are going. And they're still doing a great job. So these are the moves that we learn in the beginner's class. Nice job. Nice job, everyone. Any question? I have about 15 minutes that I can just come down, and if you have any questions or anything, are there any, do we take questions from the audience? Okay. Okay.
Can you take an advanced class if you haven't had a Tai Chi class? I mean, it builds on itself. The classes build on themselves.
Right. So yes, thank you, Caroline. So the beginner's class, that was the beginner's move. So in the intermediate class, we have additional about 10, 15 forms that we add to it, and then we review all of them. And then in the 3 advanced classes that I have, those are 73 forms. So the first class that I teach, it's the 48 forms that I teach. And then the next level, it's from 49 all the way to 73. And I do have a class that they've already learned all of these moves. And all we do is review of the forms, and we just fine tune the moves, and we just focus on the posture and the techniques. And on my flyer, it does have the description of all the classes. Mhm. So this was, oh gosh, I can't remember the beginners. I think, well, the forms, how many forms? 15? No, it's more than 15. John says 15. I'm sorry?
You always do them in the same order? The moves?
The same.
Order.
So
Same order.
yes, if I'm doing the correct, so the moves that I just showed you, yes, the orders I do not change, but at the end of each class, we do have individual balance exercises that I mix them up just to work on balance. Yes.
So are you going through your, so you're going through a few of those each time and
It's-
learning, or going through the whole thing and gradually learning?
No. So it's just one form. So the first week, we'll only learn the warm-up session. The second week, all we learn is this part. So we break it down into pieces with the arm and the hand move, with the arm and the leg movement. Correct. So in Tai Chi, they say it does take about 6 months to master a move. So it does take some time.
If I were to start humming during class, would I be kicked out?
No. So the other thing that I forgot to mention is if you've never done Tai Chi before and you don't know whether this is the right class for you, you can come to my class for a week. You don't have to pay or anything. You come to the class for a week, you try the moves and see, oh, yeah, this is the class for me, or this is not the right fit for me. So you can always come to the class for a week without any pay, just to try it out.
This question is from the live stream home audience, wondering if there's any regulars who would give a testimonial on how this has improved their balance. This is Margie.
It's not only wonderful for your balance, it's wonderful for your mental health. And Adrineh is a fabulous teacher.
Thank you, Margie.
Can't beat that.
So the Parks and Rec program teaches Student 73. Is that what this is? With
I do
Dr. Lamb?
not, to be honest, I've never seen what they teach. I
Okay,
do not know exactly what kind of forms they teach.
it's
And
the Dr. Lamb, the foundation, or the Arthritis Foundation. I think it's the same.
that is where I get my certification through
Yeah.
Dr. Lamb. Yes.
Okay.
Yep.
I was wondering if you do like yoga teachers, do you go around and make sure people's posture is correct, or do we just watch you?
So I do follow exactly what Dr. Lamb teaches. I do not put anybody on the spot that they are not doing the move correctly. I do have the mirror that I can see everybody's move. And if I can see the move is not correct, that it's going to be causing some injury, yes, I do stop and I tell them to focus on their posture, the hand position to get the most benefit. Correct.
Are there other questions?
Tai Chi is also done with a sword, right?
Correct. I do not use any of the tools, no.
Okay.
Any other questions? If anybody has some specific questions, you can sign up in the back. There's water and cookies in the back. And Adrineh will hang around a little bit outside for a while if you want to have some specific questions for her or individual questions. Other than that, we're going to start to wrap it up. I want to thank her for
Thank
the
you.
lesson. It was phenomenal. I almost was able to balance through one or two of the first moves, and after that I was gone, but everybody else seemed to do well. And as was mentioned, our next program is a combination, it's a hybrid program, live and live streamed on palliative health. Also want to mention some of our upcoming things over the next couple of weeks. For those of you who might not have seen all my 8,000 emails, Friday, we have fun and games, and it'll be in the teen center for this last time, and then we move into here after that. May 4th is the tech club, and that's on home security. If anybody wants to sign up for that, that's a Zoom. On May 9th, it's full, but you know, we may have some dropouts, is Blackjack Battlefield. We're going there for a reenactment of John Brown and to celebrate his 223rd birthday. There will be cake. May 11th, Wine Around the World Zoom, and May 17th, Dessert in a Movie. That Maze is Sing Street, which is kind of just a fun movie. And it's just kind of something we're going to watch and discuss among ourselves. It's really enjoyable, really cute movie. May 20th, also full right now, but you know, get on the wait list. We have two groups going to the Topeka 1960s Fallout Shelter, which is really a trip. It's a great tour and a lot of fun in Topeka. And then we have, you know, all the rest of the events out through October. So check your local listing there. You'll be getting an email from me in the next few days on the new 3 that I haven't included that I just set up that are coming up. One of them I'm going to mention, if we have any knitters, crocheters, hand sewers, cross stitchers, anybody who works with not a sword, a needle. We're going to start a Stitch and Bitch group May 15th at S&S Artisan Pub and Coffee House, 2 to 3 o'clock. If we have a reasonable group there, we will make it a monthly occasion. So that'll be a new event. And other than that, I thank you all for coming. Stop by our booths in the back and get your little giveaways and cookies and waters and reward for being a wonderful crowd. Thank you very much for being here.